But typically 80% of the time, there's things there that can help you either eliminate answers right away, hit the answer right away, or give an idea what's going on. So examination shows brownish gray discoloration of the teeth. Done. Stop. Tetracycline. There's the answer. Done. All right. Fair. Easy. Yeah. I didn't do it because it's easy. I did it because A, you might be able to get some information like this. And then B, I force you, I suggest strongly, and I force this upon you, you should be able to go, once you get this answer, review it. Okay, obviously contraindicating pregnant women and kids less than 8 years old. Learn as much as possible. It accumulates in teeth and bones called because of tendency to form complex with calcium salts. Wow, that's teratogenic. You don't want to give it in pregnant women. You don't want to give it in kids less than 8. But do you know the other ones? Do you know about chloramphenicol, Cipro, sulfa, gentamicin? You should. Gentamicin, we've done this before. We said buy at 30, sell at 50. I've done a lot of this before, guys. I know you should watch the videos if you haven't, or jump back on when I start doing micro. The beautiful buy at 30, sell at 50 mnemonic or phrase. Buy at 30, at is Aminoglycosides tetra. It says at 30 because these two drugs, drug classes, inhibit 30S inhibitors. They inhibit 30S, they're 30S inhibitors. All right. So the cell is chloramphenicol, clindamycin, erythromycin, linezolid. These guys inhibit 50S. Okay. So will you always get a question? Maybe not. I don't know. But when you see aminoglycosides, what two things can aminoglycosides cause as adverse effects? Look at the name. N and O. The word no is in it. That triggers for me nephrotoxicity, ototoxicity. I hope you realize I don't do this for you guys to listen to me and hope for me to give you every possible clue out there because it's too much. I'm showing you how I do things so you guys can do the same thing. For example, erythromycin. Do you know the other drugs that macrolides are under in the category? You should. A, azithromycin. C, clarithromycin. E, erythromycin. Okay. Clindamycin. I know clindamycin is used for anaerobic infections, usually above the diaphragm. What do you give below the diaphragm? Metronidazole. So this is what I'm showing you with Pharm. If you have one question like this, and I know all of you, you get easy questions, you keep moving. This is an opportunity to pass the test and move on to be done with the step one. Step one has taken a lot of victims. People have failed once, twice, thrice, and they keep trying to pass the stupid thing. It's not easy if you don't play the game right. If you play the game right, you pass and move on. If you don't play it right, man, you'll be stuck like this forever. And that sucks. Because now what you should do is say, okay, Stavro, I get it what you mean. I go through each one for a few moments, read the stupid thing, read this one, so you know what Cipro is this. Ciprofloxacin is a fluoroquinolone. Fluoro is also DNA, it inhibits DNA gyrase. Knowing terms interchangeably will help you. And fluoroquinolones, we said, they cause QT prolongation, tendinitis, rupture, cartilage, tendinitis, and then you can't give it in kids less than 18, and you can't give it in pregnant women. This is what you need: cartilage damage, tendinitis, pregnant women, and so on. The more you do, the more you learn. The more you learn, the better you become. Just being honest. Just showing you guys the game, right? Now, if I show you this, hold on. You saw this: trimethoprim, sulfa, Cipro, Genta, chloramphenicol, Tetra. Tetra, buy at 30, sell at 50, right? We said Tetra is what? Tetra is going to be this guy. Boom, 30S inhibitor. Then you see chloramphenicol, 50S. Then you have Cipro, DNA gyrase.